Oh, hello. I didn't see you there. Today we're going to be talking about opioids and how you can misuse opioids. So, without further ado, let's get started. So, I'm going to ask you a few true and false questions that I'm going to want you to answer. I want you to have it answered by the end of this video. So, you'll have it ready. So, I'll just ask you one. One way that people misuse opioid pain medicines is taking pills that are not prescribed for them. You can answer if that's true or false. Like I said, I'll answer later on in the video. People of any age, income, education level, and gender can abuse prescription medicines. You can answer if that's true or false. And lastly, you could be addicted if you continue to refill a prescription for a painkiller after the health condition it was prescribed for has been cured. You can answer if that's true or false. I'm also going to ask and answer some anticipated questions I feel like you would answer because obviously you won't be able to ask me anything due to being quarantined. So I'll come back to that towards the end of the video. So I'm just going to start off by saying how it's important to teach this because if young adults don't understand the side effects and life-threatening causes opioids can leave on someone, many people could be risking their lives. I know for sure if that I wasn't educated on the symptoms opioids can lead to, I would definitely be using them to just help me fall asleep at night if I have to wake up early in the morning, or just to help me relieve any type of pain, whether it's like a small sports related injury from like me getting a bruise to even surgical pain, and etc. The list goes on about how many things you could use it for, but those are mainly the ones that people mainly use it to relieve pain, help fall asleep, and help your emotions, because a lot of people with anxiety and depression tend to try to use it to help them feel better when they don't know that later on in life that if you keep misusing these opioids, they can make your depression and anxiety feel 10 times worse. So this is something I feel like everyone should know because people abuse the power of opioids when there are other safer ways to deal with life's difficulties, which I will explain soon in this video. So the goal is mainly to inform students the dangers of getting addicted to any type of opioid. If pain is too overwhelming, it's highly recommended to talk to a doctor about ways you can manage your pain that don't involve opioids. Some options that may actually work out that have fewer risks and side effects include non-steroidal medication, such as ibuprofen or naproxen, epidural or spinal anesthesia, local anesthetic nerve blocks, and regional anesthetic medications, neuropathic medications such as gabapentin or pregabalin, antidepressant medications, physical therapy or structured exercise programs, cognitive behavior therapy. That one actually has been known to not really work as well. But like I said, there are different levels to these options. Some work better than others, but I know cognitive behavior therapy isn't the best. I know a lot of times half of people relapse. You could also try mindful meditation, and the list goes on other ways you could beat opioid addiction. So if prescribed opioid, never take them in greater amounts or more often than prescribed. Never sell or share prescription medications. Well, prescription opioids. I know if you give them to someone who is not prescribed that type of medication to, you could be risking their lives. You could be risking their lives, and they'll be in danger if you give them that opioid that they're not prescribed to. You could also be risking yourself getting in trouble because it's against the law to give or sell opioids to someone else. So store them in a secure place where others won't be able to find them. And if not needed anymore, dispose of them carefully. And by carefully, you could just go as simple as just flushing them down the toilet. So if you are addicted to it, once you flush them down the toilet, you won't be able to get to them anymore. That could help with your addiction, and other people won't be able to get to it either. Whereas, like, if you have it on the desk, then your addiction will get the better of you, and you could end up just taking it. So it's important to do that. For reference, I found that the U.S. Department of Health and Human Services states that long-term opioid use often begins with treatment with acute pain. Like the pains I said before about like getting a sports injury or so stuff like that. So when opioids are used for acute pain, you should use the lowest effective dose for the expected duration of pain severe enough to require opioids. So just a quick personal experience. I'm not going to say the name of this person for personal reasons. But someone I knew forced themselves to take an opioid because they were having terrible pain after their wisdom teeth surgery. They refused to take it at first, but the pain was so unbearable that they gave in and took one because they couldn't fall asleep at night from the pain. It's very painful, and that's part of the reason why your neurosurgeon prescribes these opioids to you, just in case you really need them. It was an oxycodone opioid, and it did the trick. It relieved the pain, and luckily they didn't get hooked on them after the surgical pain was over and done with. After the pain in the wisdom teeth was fully gone, they never used opioids again because they were scared that they would get addicted to them. So it's good that they were stressed out about the effects of opioids a little bit because they were educated and well aware of how bad these opioid aftermaths could be. I'll explain later, usually in about a year, of how many people die from overdosing on these opioids. So many patients experience pain after surgery, and anesthesiologists play a critical role in reducing and managing that pain. So it's a good idea to talk to an anesthesiologist for more options. One option is an opioid medication, like I've just been explaining to you. These work by binding opioid receptors in the body, which reduce the sensation of pain. That's mainly the reason why people take it. They are an important class of pain-relieving medications. However, opioids also carry serious risks of addiction and overdose, especially with prolonged uses. 3 days or less will often be sufficient. More than 7 days will rarely be needed. Commonly prescribed opioids are Narco, Percocet, Ultram, hydrocodone, oxycodone, and tramadol. Opioids can have several side effects as well, even taken as directed. It could cause confusion, sleepiness, dizziness, increased feelings of depression, itching, nausea, vomiting, and very bad constipation. It also relates to tolerance, which means you might need to take more of a medication for the same relief, for like the same pain relief, I would like to say. So physical dependence plays a key role in it, and that pretty much means that there are symptoms of withdrawal when a medication is stopped, okay? And that ends up leading to addiction, which is cravings from opioids, which negatively impact your behavior, emotions, and relationships. An overdose of opioids can cause slowed breathing and can even cause sudden death. like I said before, I'll give you the number of how many people die a year from misusing opioids. But if anyone feels like they're struggling with addiction to opioids, it is very strongly, I'm strongly recommending to a healthcare provider for guidance, because they'll guide you in the right direction of they'll guide you in the right direction for, instead of taking opioids, it'll lead to everything I named before, like whether it was meditation or epidural needles and etc. So humans have known about opioids and their pain relieving and euphoria inducing properties for a long time. And this was invented for the sole fact to get rid of pain easily. A fun fact about opioids is that they inhibit the pain signals at multiple steps in this pathway. They work in the brain and spinal cord, and even in the periphery, which is in the brain. And the opioids have mood altering effects that cause sedation and can even decrease emotional responses to pain. So opioid medications are so effective at treating acute pain because they attack it from every neurological angle, to say the least. And yeah, so we pretty much began teaching people in life that pain is bad and that we can get rid of it. And you have the right to not be in pain. So this is what drove a whole new wave of addiction, because those initial small studies were simply wrong. Because small studies from big pharmaceutical companies claimed that high-powered painkillers were safe and that there was minimal risk of becoming addicted, leading to waves of over-treating chronic pain. So over time, patients start to feel trapped by the pills they were once given to make them feel better. They are incredibly valuable medications, but only for a short time and for targeted purposes. Typically, safe short-term opioid uses include surgical patients and trauma patients. It can also be safely used to treat terminal care patients suffering severe pain and cancer patients with pain that won't respond to other medications. Even then, it is important to know that we're living in a whole new world of addiction. Okay, so I'm just gonna quickly let you know if the answers were true or false for the questions after everything I just taught you. So to repeat myself, one way that people misuse opioid pain medicines is taking pills that are not prescribed for them. If you said true, then you are correct. People of any age, income, education level, and gender can abuse prescription medicines. If you said true to that one, you are correct. And lastly, you could be addicted if you continue to refill a prescription for a painkiller after the health condition it was prescribed for has been cured. True. Yes, if you said true, then you are correct. All three of them were true. And yeah, those questions pretty much just clearly stated how addicted you could be and the dangers of how you could be addicted to. And it's like facts that it's true. So some anticipated questions I feel like you guys would answer, would ask me, would be how many people die from opioids a year? And the most recent data from Centers of Disease Control and Prevention in 2017 show that more than 70,000 Americans died from overdoses. So that's a very big number, and you could tell that it's being misused, and it's probably going to continue to be misused because of how addicting this could be and how easily it is to get, because doctors very easily prescribe them to their patients who are just telling the doctors that they're feeling pain when really they're misusing them and abusing the drug. Are there any successful treatments? Usually, treatments begin with detoxification, where they try to beat the cycle of withdrawal. It often continues with rehab, either in the inpatient or outpatient setting, often with pharmacotherapy as well as behavioral therapy. And like I said before, unfortunately, behavioral therapy doesn't stick. About half of those in rehab end up relapsing. And another question, what are the warning signs of opioid abuse? That would mainly just be the person's, how do I say? The I would say the person's emotional level. You would be able to tell if you know that they're taking stuff like that, and you notice a change in emotion. That would usually include like behavior changes, change in the interest level of normal everyday activities, and usually let go of some activities they used to engage in on a regular basis. So those are some warning signs when you know someone is getting addicted or suffering from addiction to opioids. So that pretty much clears up the presentation. Hopefully, all you students were able to list all the different types of opioids, be able to explain the risk factors if opioids are taken carelessly, explain the symptoms of opioid usage, what else, to explain the reason why people take opioids, and explain what happens to people if overdosing on opioids, which I said before could lead to like dizziness, nausea, all that stuff, and obviously the worst one of all, death. So hopefully you learned a thing or two about opioids, and thank you.